My business is to talk about depression and anxiety today. It's a big call to cover this all in half an hour. And so to get through as much as we can and leave you with as much information as possible, I've given out a bunch of these handouts, which I hope, I had 100 done, so it should cover most people in here, but you can share, I'm sure. There's some general stuff about psychiatric illness, brain illness in general, but specifically that's going to apply to my talk is on the third page of this little lot are the symptoms, the primary symptoms of depression, which I want to spend some time on now. Cheryl, could we have it's up here. The terrible twins of depression and anxiety. At a guess, there are 100 people in this room at the moment, which means that there are somewhere between 15 and 20 ladies who have had or are going to have depression at some time in their adult lives. There are about half that number of men, somewhere up to 10. So the prevalence of depression is 1 in 5 women will suffer from the illness at some time in their lives. It's about half that number of men for all sorts of reasons we won't go into now. Anxiety is about as common. The combination of these two, which I'll explain to you later, the relationship between them is absolutely devastating. We're going to talk about depression first because it's easier to get a grasp on. There's no question about depression being a biochemical illness primarily. If you have a look at the list of symptoms on your handouts, you'll see that most important of those symptoms are to do with the way you're feeling. The only people who really understand what depression is about are people who have been depressed. Those of you who have been depressed in here, I won't ask you to put up your hands, but there's a pile of you. Part of the problem of being depressed is that friends, carers, professionals who have never been depressed do not, and by definition cannot understand, I just see a lot of nodding heads around here, of how bad it feels when you're in the black pit. There's just no light and you don't know your way out of it. Those are the primary symptoms of this illness that we call depression. Depression itself is a bad word because it's a clinical term, but it's used daily in our English language. Well, I'm feeling a bit down, a bit depressed today. The illness, depression, by definition, needs to have had symptoms for a week, 10 days, 2 weeks, and sometimes longer, with somebody feeling hopeless, helpless, no possibility of looking ahead of any future planning. And when it gets bad enough, actually the feelings of, if this is what my life's all about, maybe life isn't worth living. Depression remains the commonest reason for people taking their own lives, which, may I remind you, is about 2/3 the number of people who die on our roads every year. We hear of the rough figures, 14,000 to 15,000 people killed on our roads every year, and we call that a catastrophe. Well, about 10,000 to 12,000 people a year commit suicide. The commonest cause of suicide is depression, because when you're in that black pit, and thank God I've never been there, I think I've looked after enough depressed people to have an inkling of what it must feel like, but I've never been there. And I know that, in fact, I don't know what it feels like, other than when it gets bad enough, the desperation means